Welcome to the Rochester Regional Health Service Behaviors AIDET training. With the guidance of leaders, frontline staff, patients, and their families, Rochester Regional Health has defined what it is we mean when we speak of patient experience. The definition is our North Star. It grounds us in purpose and reminds us that every interaction matters. It's more than a statement, it's a promise we make to our patients, families, and each other. This is not a statement, but a promise, something that involves and depends on all of us to come to life. The Rochester Regional Health Patient Experience definition. We are the patient experience. Every interaction across the patient journey shapes how patients and loved ones feel and what they remember. We are committed to fostering a culture where engaged, resilient teams create meaningful moments that enhance patient perception. Through empathy and excellence, we ensure every touchpoint contributes to a positive, lasting experience. Every patient, every time, we are here for it. Rochester Regional Health Service standards come to life through 5 everyday service behaviors. These are simple, practical actions that help us deliver consistent, compassionate care. Let's take a moment to walk through each one together. Follow the 10-5 rule. Smile and make eye contact at 10 feet. Greet at 5 feet. Success isn't about getting a response. It's about making others feel seen, valued, and safe. Be present. Limit distractions and give full attention. Being present means being mentally and emotionally where we are physically. It improves listening, understanding, and empathy. Being present reduces stress for others and ourselves. Clearly communicating expectations. Share what to expect and how long it will take. Clear expectations reduce anxiety and empower patients and families and strengthen the relationships we have with our coworkers and team members. It involves engagement and it reduces misunderstandings that can lead to frustration or escalation. This behavior connects directly to the duration and explanation elements of AIDET, which we'll explore next. Offering help. Solve or connect the person to someone who can and follow through. Offering help and following through builds trust and safety, the foundation of healing. Demonstrate gratitude. Thank patients, families, and each other. Gratitude improves morale, reduces burnout, and strengthens relationships. Gratitude is a gift. It touches hearts and creates connection. These behaviors aren't just for patients, they're for each other too. When we live these out, we create a culture of healing and belonging. What is AIDET? AIDET is a communication framework to enhance interactions between patients, families, caregivers, and team members. It's a simple framework that helps us communicate with clarity and compassion. AIDET originated a couple of decades ago in healthcare in response to recurring patient needs, anxieties, and addressing gaps, and is built on the concept of the power of key words at key times. These key words at key times are evidence-based and prove to reduce anxiety, build trust, and improve outcomes in every interaction. To review, Rochester Regional Health Service Behaviors and AIDET is an acronym. The keys to effective patient and customer communication include A. Acknowledge. Follow the 10-5 rule. I. Introduce. Be present. D. Duration. Clearly communicate expectations. E. Explanation. Offer help. T. Thank you. Demonstrate gratitude. To review the AIDET fundamentals and why. Acknowledging indicates that I want you to know you are important. Introducing is that I want you to know me and my experience and that you can trust me. Duration indicates that I respect your time. Explanation is that I want you to understand what I'm doing and why I'm doing it. Thank you. I appreciate you and all that you've done here and all that you are trying to do for either a loved one, a coworker, or yourself. If you remember just one thing, please remember this. AIDET is evidence-based to decrease anxiety. When you reduce patients' anxiety, there is an increased commitment and engagement, greater willingness to follow their plan of care. This not only leads to better outcomes and a better patient experience, but it also makes your job easier. The same is true with your coworkers and team members. Clear, consistent, and compassionate communication, every interaction, every time. While many behaviors feel like common sense, only a small portion are consistently practiced. Our goal with service behaviors and AIDET is to close that gap. So what we know becomes what we do every interaction, every time. Because our patients are telling us we aren't doing these things. And we want to become closer to meeting their expectations and improving and optimizing the patient experience as well as families, loved ones, and the relationships that we have with our coworkers and team members. Let's bust a few myths about AIDET. It's not a script, it's a flexible framework. In other words, use your words. The order doesn't have to be AIDET. Usually A and I come first. It would be weird to start an interaction with 10 minutes or I'm gonna draw your blood. It's for everyone, not just nurses or patients. Yes, it seems like common sense, but it's not yet common practice. Every interaction, every time. And no, it doesn't take more time. It actually helps us be more efficient and effective. It just takes 40 seconds to make a meaningful connection. Consider how powerful even a brief conversation can be. A warm greeting, a clear introduction, and a moment of empathy can change someone's experience entirely. The point is, it doesn't take long to make a big impact on the patients and team members we serve. The next topic we'll cover is managing up. Managing up is a practice of positively positioning your team, colleagues, and yourself in front of patients and families to build trust, confidence, and reassurance in their care experience. Managing up is not about bragging. It is to reassure patients and others that they are in good, capable hands. Managing down is unintentionally positioning colleagues, teams, departments, or organizations in a negative light to deflect frustration or avoid conflict. Managing down can be subtle, but erodes confidence and comes across as unprofessional. An example of managing down would be when the unit is busy or short staffed, and you were to say, "We're really short staffed today," instead, it would be better to say, "It's a busy day, but our team works together to make sure everyone's cared for safely." Another example is saying, "I'm the only one here right now." Instead, by managing up, you can say, "You've got a great team looking out for you. We're just coordinating a few things, and I'll make sure your needs are met." On the next few slides, review the 6 scenarios that are examples of managing up versus managing down. Let's review our service behaviors and AIDET, delivering exceptional care through a shared commitment to service. Acknowledge the patient, their family, or your team member. Make eye contact, smile, and use their preferred name. Introduce yourself by name, role, and department. Explain why you are there. Tell the patient, family member, or coworker how long a procedure, care, or service will take. Provide a time frame and let them know you'll update them if things change. Explain what is going to happen next in simple, easy to understand language. Check for understanding and invite questions. Thank the patient, their family member, and loved ones for choosing Rochester Regional Health. Thank your team member and coworkers for their hard work and collaboration. Thank you for your participation in this presentation of Rochester Regional Health Service Behaviors and the AIDET framework. Also, thank you for the difference you will be making for your patients, families, and team members by implementing this framework in your everyday work, life, and behavior.